Okay, so we're gonna do a few different glenohumeral joint mobs in varying degrees of abduction, flexion, rotation, all those things. So we'll start here with the AP mobs. If we're gonna do any grade 1 joint mobs, Cook and Maitland both suggest doing those in supine and grabbing. I don't have a high-low table at my home, but grabbing either side of the proximal humerus here and actually using either the thumbs on the anterior side to give it the grade 1 AP, which I'm actually probably going more into a grade 2 for him, grade 1 there, and then just using the fingers on the back side to very gently push up into a P to A position here. Because typically if we go prone with forward shoulder people, we typically are already falling into, we would automatically be at a grade 3 because they're typically closer to in range there. So they suggest doing both of these in supine. Going on from there, if we're ramping up in our grades, still going from AP, I'll just change my grip. I usually use my leg to support, so I don't have to use my arm so much. I'm going to use the table as a third hand to block the scapula on the back side. And I'm going to use this hand, outside hand, to give myself just a little bit of distraction while I'm doing the joint mob. And then the inside hand is going to be on the anterior proximal portion of the humerus, and trying to use some good body mechanics here to press straight down to the floor, straight elbow, nose over mobilizing segment, and then of course pressing into our R2 to do a grade 4. From here, we can do some quadrant mobilizations, which Maitland and Cook both have varying types listed. If you're interested, Cook's are on page 206. Maitland's are on there's some on page 155 and some on 250. But they have a lot of different types on there depending on what they're going for. So in supine, we can basically vary the degrees of abduction and then rotation is what most of their mobilizations look like for the quadrant mobs. So I'll use my leg to help support me here to go into differing levels of abduction, outside hand to vary my levels of rotation, and then inside hand to give actual mobilization. So if I'm still doing an AP, we can come up into say 90 degrees. They have a lot of theirs are up closer to about 120 degrees of abduction. Allow that arm to drop into external rotation, and we're giving some AP here. As long as they can tolerate that, of course, we would be testing like an apprehension sign before doing anything like this, and mostly looking at mobilizing posterior capsule and inferior capsule here on this one. And then we can vary the levels of rotation as well. We can also, if we really want to focus on internal or posterior capsule, so we can do more internal rotation. So we can come here and prop them, if you can see, into more internal rotation. Same thing, but we're just giving that A to P force there with varying. We can start in neutral and then creep down into more internal rotation and give more of a posterior capsule glide. Let me make sure I'm doing everything that I said I was going to do. Okay. From here, you can also, they showed a few ways where you can drop them into extension and then go a little bit more. But most of what they showed was with abduction rotation. So also in supine, we can change it to be an inferior joint mob, and we can vary the levels of flexion here. As we know, if I was doing this as more of a grade 1 or grade 2, I would have him more in a loose pack position. But Cook really suggests doing these in different levels of flexion because it's more functional. So I'm coming on the superior part of the humeral head here. I'm still using this arm to help give me a little bit of traction. And then I like to tuck my elbow into my hip to help with my mobilizing force as we press down here. Yeah, he's got some good guarding there. And we can come into more levels of flexion. We can creep it down a little bit. And then really easily from this position, we can drop into that quadrant position as well. And still, rather than doing an AP, we can just, from this quadrant position, we can still do like an inferior mobilization there. Can flip it into internal rotation and do similar. In the clinic, I might use other like props to help me maintain my rotation, like wedges and stuff, so that I can use my hands to better block the scapula. A lot of times they even will have them in these quadrant positions, and then we'll reach under and actually do scapular depression moves and just use this arm to help increase levels of rotation while they do scapular depression, which is really good too. And then they can flip that and do the same thing with rotation, internal rotation. Okay, go ahead and turn on the stomach. Okay, so that's some of the quadrant moves in supine. Now, for the quadrant moves in prone, we of course already did the grade 1 P to A move in supine, but then if we want to do a progression, I like to go into prone. So you can do a prone progression starting in neutral and moving up into a Faber position, similar to what we looked like in supine, but instead we are just here. We can prop the arm there and be relaxed, and I can give a P to A here. Show there. Acromion is, scoot towards me just a little bit. That way I've got the table helping to block there on the acromion, and I can use the table to help me get a really good, I would be better in the clinic, my poor husband. Okay, walking him with my leg, distal humerus, and giving that P to A force at the proximal humerus. Would love to be able to switch, block his hand a little bit better, and can even come down this way. Oh, yeah, you can actually see that in the video. So just depending on the patient on what's the best position to go in. Maitland actually shows this mobilization as well as I'll show this with internal rotation, doing literally PAs to the scapula. So same thing, just holding this position, and he does some with depression of the scapula, and then he actually gets on like the, especially with the internal rotation one on the medial border, and presses and gives a PA to the medial border of the scapula, that was new to me. Okay, so there's that prone progression from neutral to Faber of a PA, and then make sure I'm not forgetting anything. Okay, yeah, the last one is the one I was just saying, where we're doing this quadrant position here. Hand is behind the back, blocking here around distal humerus elbow, and he gave a PA to the inferior border of the scapula there. And you can also still come and do a PA. We can do inferior scapular moves. We can do all of that and just try to raise into a little bit of internal rotation. But yeah, those are all the different quadrant moves that they showed in the Maitland and the Cook text. And if I need to cite any of those page numbers for you guys, I'm happy to do it.